Hello everyone. Today we are going to have a discussion on a very important topic, and that is CBC, understanding the importance of the very basic and a fundamental investigation, that is the complete blood count. The problem with the CBC is that all of us, we order this CBC as a practitioner, but we tend to just focus on the hemoglobin values and the total leukocyte count. That's it. We tend to ignore rest of the important parameters which might help us in making the direct diagnosis on the CBC itself, or it can help you in understanding the basic problem the patient is suffering from and can guide you to the next set of investigations in order to reach the final diagnosis. So this is exactly what we are going to talk about. The most basic of all the investigations, the first investigation in majority of the cases, that is CBC. For those aspirants who are appearing in NEET PG examination, this also is an important topic, not only for the young practitioners. That is why it is also kept in the form of the question, that how this thing could be framed in the form of the question, and then they can ask you the direct diagnosis. Like a 45-year-old woman presents with the complaints of fatigue, pallor, mild shortness of the breath. She has a history of poor dietary habit and occasional numbness in her hands and feet. The CBC report is as follows, where hemoglobin is low, RBC count is low, the MCV, MCH, and MCHC are high to normal. The WBC and platelet count are mildly reduced, and what is the most likely diagnosis? So this is a sort of a question where only the CBC parameters are provided, and then they are asking you about the diagnosis for this particular complaint. So this is exactly what we'll be talking about. So the first thing obviously is that what is what in the CBC. So the first thing is, what is this total RBC count and why is it important? Now imagine, just try to understand. If we are having a blood vessel where in per unit volume of this blood vessel, there are a specific number of the RBCs which are present. So this is the count of the RBC. As simple as that. So this is the total RBC count. So what is total RBC count? It is the number of the RBCs in blood. And what is the unit which is used? Because the normal number in case of males, it is around 4.7 to 6.1 million per microliter of the blood. While in case of females, the number goes as 4.2 to 5.8 million per microliters. So these are the normal numbers for the RBC count. So just now you came to know that this total RBC count is the measure of the concentration of the RBCs in the blood. And it helps to diagnose the anemia when the RBC count are low, or polycythemia where the RBC counts are usually higher. So that is RBC count. Another factor which is provided is the PCV, that is packed cell volume. What is PCV? Imagine if this is the blood vessel, and in this per unit volume of the blood vessel, what is the concentration of the RBC volume in percentages? Because here in this per unit volume, there could be presence of the RBCs, the WBCs, and the platelets. So what is the packed cell volume? It is the percentage of the blood volume which is occupied by the RBCs. The normal values are, in case of males, it is 40 to 52%, while in case of females, it is 36 to 48%. Now, what as a question that you might be thinking is that both these two are measuring the concentration of the RBCs. Like both, in case of packed cell volume, you are measuring the concentration of the RBC, and in case of total RBC count, you also are measuring the concentration of the RBC. Then what is the need of a different scenario? Why these two parameters are needed differently? So answer for that question lies in the fact that the packed cell volume, it measures the percentage of the blood volume occupied, while the total RBC count measures the number of the RBCs per microliter of the blood. So what the packed cell volume focuses on is the volume. It focuses on the volume, while the RBC count, it focuses on the count, that how many RBCs are present. So despite the fact that both of them are measuring the concentrations, but the parameters they are measuring are different. So how it can be affected? It can be affected by the size of the RBC and the number of the RBC in case of packed cells, while the RBC count can be affected only by the number of the RBCs. So if I try to explain this with an example, for example, if the patient is having a thalassemia, where The RBCs obviously are smaller, so the patient might be having many small RBCs. As a result of which, the RBC count will be higher, but the packed cell volume, it could be either normal or relatively on the lower side, because PCV is measuring the volume and small cells occupy smaller volume. If I give you another example, like in case of megaloblastic anemia, as the name indicates, megaloblastic means the RBC counts are usually lower because the RBC number is usually fewer or lesser, but RBC size is larger. So here the RBC count will be on the lower side, but the PCV may still be somewhat preserved because a large cell occupy more volume. So this is the reason why these two parameters are different from each other. They are not one and the same thing, and that is the reason why both of them are having their individual significances. So hopefully you have understood the importance of both the RBC count as well as the packed cell volume, that is hematocrit. Now, each one of us are aware of what the hemoglobin measures. It measures the blood's capacity to carry the oxygen from the lungs to the body tissue. It helps in detection of the anemia, blood loss, or the disorders that are affecting the RBCs. So, what are the normal values for the hemoglobin? In case of males, it is 13.8 to 17.2 gram per deciliter. This is something which we are already aware of. And in case of females, it is 12.1 to 15.1 gram per deciliter. You know, but this hemoglobin values alone are of no use in order to make the diagnosis. It just is suggestive of that the patient is having anemia. That's it, if the values are lower. What is more important for us to understand now is that what is this MCV, that is mean corpuscular volume, what is this MCH, that is mean corpuscular hemoglobin, and what is this MCHC? So this is what we are going to talk about in this session. And the point one, number one is MCV, that is mean corpuscular volume. You know, as the name indicates, volume means it measures the average size of a single RBC, which means that how voluminous the RBC, the single RBC is. So MCV is a key starting point not only to diagnose the anemia but also to categorize the different types of the anemia. Like if the size of the RBC is larger, then it would be categorized as macrocytic, while if the size is smaller, then it would be microcytic. That means if the patient is having anemia, that means hemoglobin count is extremely low, but at the same time the MCV values are higher or larger, then it will be categorized as macrocytic anemia. While if the hemoglobin values are low and the patient is having a smaller MCV, then it will be categorized as microcytic anemia. For that, you obviously have to understand that what is the normal range for this MCV. The normal values are 80 to 100 picoliters. And how is it calculated? The MCVs are calculated as the ratio of the hematocrit, obviously in percentages, that is packed cell volume, to the RBC count multiplied by 10. And you know the values of the RBC count is taken in millions per microliter. Hematocrit, that is packed cell volume, is measured in percentages, and the normal values or the normal range is 80 to 100 picoliters. So what is the inference? Like, as I told you, that if the patient is anemic, that you will come to know by looking at the hemoglobin concentration. But this anemic patient can also be further categorized into either macrocytic anemia or microcytic anemia based upon the size of the RBCs. You all know the causes of macrocytic anemia like megaloblastic anemia, the alcoholism, some of the liver diseases, and even hypothyroidism. While the reasons for the microcytic anemias are the iron deficiency anemia, the thalassemia, and the anemia of chronic illnesses. Next parameter to study is the mean corpuscular hemoglobin, that is MCH. Now, MCH tells the average amount of hemoglobin present in each red blood cell. That means the concentration of the hemoglobin in the RBC. So it helps in identify whether the red blood cells are probably loaded with the hemoglobin or not, giving clues about the types of the anemia, like hypochromic anemia, like iron deficiency anemia. So MCH is important for the assessment of the hemoglobin content inside the RBCs and to detect underfilled or overfilled RBCs. So how to measure this MCH? It is in the picograms. That means you are measuring the concentration of the hemoglobin. So it is the calculation of hemoglobin, which is in gram per deciliter, divided by the RBC count, which is in millions per microliter, multiplied by 10. So the normal range of the MCH is 27 to 31 picograms. As you know, that increased MCH, where the hemoglobin concentration is increased in the individual RBC, that means RBC is responsible for carrying more hemoglobin, is often linked with macrocytosis, and it is seen in case of megaloblastic anemia. While decreased MCH, which means that the RBCs it carries less amount of the hemoglobin, which is often linked with microcytosis, and it is seen in case of iron deficiency anemia and thalassemias. So this is another parameter which is important for you to identify the specific reason behind this anemia. The third one is the mean corpuscular hemoglobin concentration. We'll be talking about the differences in between the two, but first try to understand what exactly it is. You see, MCHC, that is mean corpuscular hemoglobin concentration, it measures the average concentration of hemoglobin in RBCs, which helps in detecting the hypochromia or hyperchromia. Hypochromia means pale cells, as it is seen in case of iron deficiency anemia, while hyperchromia means dense cells, as it is seen in hereditary spherocytosis. So MCHC obviously is an important tool for the assessment of the color intensity of the RBCs and to diagnose anemia where RBCs are either underfilled or overfilled. So how to measure this MCHC in gram per deciliter is calculated by hemoglobin values in gram per deciliter divided by the hematocrit. That means PCV in percentages multiplied by 100. So the normal values comes out to be 32 to 36 gram per deciliter. So increased MCHC, which is obviously a rare phenomena. That means RBCs with hyperchromia. That means more color, more intensity. It is seen in case of hereditary spherocytosis or in case of autoimmune hemolytic anemia. While the decreased MCHC, which is a commoner phenomena, it is seen in case of iron deficiency anemia or in case of thalassemia, and it is identified as hypochromic. That means pale RBCs. Now, one thing that you might be thinking about is then both of them, that is MCHC and MCH, both of them are measuring the concentrations of the hemoglobin in the RBC. Then what is the difference in between the two? You see, the MCH measures the amount of the hemoglobin inside the single RBC in picograms, while MCHC it measures the concentration of the hemoglobin relative to the size of the RBC. And these two are different things. The focus of the MCH is the total weight of the hemoglobin per RBC, while the focus is the density of the hemoglobin inside the RBC for MCHC. The formulas obviously and the normal range we have already talked about are different, and the interpretation is that it helps in detect underfilled or overfilled RBCs, while the MCHC is it helps in detection of the hypochromic, that means paler cells, or hyperchromic, that means dense RBCs. So these two are different parameters as far as concentration of the hemoglobin is concerned. I just hope that you have understood each and every parameter, where in this session we have talked about only about the hemoglobin and the rest of the values which are directly or indirectly associated with the hemoglobins in order to reach or conclude to the final diagnosis. Now let's see some of the examples. Like if the mean corpuscular volume is given as low, If MCH, that means concentration is also low, and MCHC is also low, then it is suggestive of microcytic hypochromic anemia, and it could be either iron deficiency anemia or the thalassemia. Now, if the hemoglobin is lesser and is coupled with increased MCV, increased MCH, but normal or high MCHC, then in that case, you have to make the diagnosis of macrocytic anemia, which is a feature of vitamin B12 or the folate deficiency. Had there been a hemoglobin concentration low along with a normal MCV, MCH, and MCHC, but anemia is present, then it is suggestive of normocytic normochromic anemia, which is seen in case of acute blood loss or any chronic systemic illnesses. So hopefully you have understood that what is the importance of the CBC in itself in order to confirm or in order to make the final diagnosis. Now, for NEET PG students, if I give you one question that how they are, these kind of the questions which are likely to be kept in your examination, they can give you one clinical picture, and the CBC picture can be given instead of giving it as a written material. They can just give you a picture of the CBC, and then they will ask you what is the likely diagnosis the patient is suffering from. So in this first question, as we have seen in the beginning of the lecture also, a 45-year-old woman presents with a complaint of fatigue, pallor, mild shortness of breath. She has a history of poor dietary habits, occasional numbness in her hands and feet, and the CBC report is as follows, where the hemoglobin is obviously low, the RBC count is low, the MCV and MCH are high. MCHC, that means the concentration of the hemoglobin inside the cell in relative to the RBC is normal, while WBC and the platelet counts are mildly reduced. So, which of the following is the most likely diagnosis the patient is suffering from? You see, the correct answer for this question obviously is the megaloblastic anemia. Why? Because the hemoglobin is low, the MCV is high, which points towards the macrocytic anemia. The MCH is also high, that means the larger RBC, which is carrying more hemoglobin, and MCHC is normal, that means the concentration inside the RBC is maintained. Along with this, there is a feature of neurological features like numbness, which is strongly suggestive of vitamin B12 deficiency, one of the major causes of megaloblastic anemia. So that is why this is the favorite answer for this sort of the question. Now, based on these findings only, why not IDA? Because in IDA, there should have been a low MCV, not the high MCV. Why not thalassemia minor? Because again, here in this case also, there should have been a provision of low MCV, not the high MCV. And why not the anemia of chronic disease? Because anemia of chronic disease usually is having a normocytic and normochromic, not the macrocytic or macrochromic anemia. WBC and platelets are often normal unless it is advanced disease. So hopefully you have converted this question into a correct answer, and you came to know that how to deal with these sort of the questions. Next question is, a 25-year-old man comes for a routine health checkup. He feels generally well but reports mild fatigue on exertion. The CBC report is showing the hemoglobin values which are low, the RBC count is high, remember. So when the RBC count is high, it is not a feature of iron deficiency anemia. It is the hallmark feature of thalassemia minor. When the anemia is present, but the RBC count is high, it is a feature suggestive of thalassemia minor. Now, MCV is low, which is indicative of microcytosis, which is again favorable to thalassemia. The MCH is again low, which confirms hypochromia, and the peripheral blood smear shows the target cells, which is classical for thalassemia. So, answer for this question obviously is the thalassemia minor. So, why not IDA? Because the RBC count is usually low in case of iron deficiency anemia. Why not megaloblastic anemia? Because here there should be a provision of increased MCV, that is macrocytosis. Here there is microcytosis mentioned in the question. And why not sideroblastic anemia? Because MCV can vary, but smear would have shown a ring sideroblast, which is seen in bone marrow studies. So this obviously is another option which is ruled out. So answer for this question is thalassemia minor. So coming on to the next question, like a 22-year-old male comes for the evaluation. Now, if I change this question, the previously asked question, into a different sort of a question, that what is the next investigation that you will go for? Here, all the things remains the same. Like the patient is having microcytic hypochromic anemia because of the low MCV and MCH. RBC count is high, which is unusual in iron deficiency, but it is typical for the thalassemia trait, and target cells are seen on the peripheral smear, which is strongly suggestive of thalassemia. Therefore, the next logical step to confirm the diagnosis is achieved by doing hemoglobin electrophoresis to look for the raised HbA2 in beta thalassemia minor. So answer for this question is hemoglobin electrophoresis. Why not the other options like serum ferritin levels is useful for the diagnosis of iron deficiency anemia. But here the pattern, that means high RBC count and the target cells, it is pointing towards the thalassemia, not the iron deficiency. Why not the bone marrow biopsy? Because it is too invasive at this point of time, and it is not needed unless a marrow failure or leukemia is suspected. Why not the reticulocyte count? Because it is useful for the assessment of the marrow response, that is hemolysis, acute blood loss, but it is not the first line for suspected thalassemia. So that is why the best answer for this question is the hemoglobin electrophoresis. So I can just hope that you have learned something new. I hope that you will be able to mark the answers correctly. And for the young practitioners in particular, this session was of help. In order not to miss any update, please join our Telegram group. The link is provided to you in the description. Many of these sort of the sessions are about to arrive in our app, so please get it downloaded. The links are provided to you in the description for both Android as well as iOS. All the best for your future. Thank you very much.